Question 1. A CNA observes a resident with a sudden change in mental status, including confusion and disorientation. What is the CNA's most immediate and appropriate action? A. Reassure the resident and continue with scheduled care. B. Document the observation in the resident's chart at the end of the shift. C. Report the change immediately to the nurse. D. Ask the resident's family if this is a normal occurrence. Answer: C. Report the change immediately to the nurse. This question tests your understanding of a CNA's crucial role in observation and reporting. A sudden change in a resident's mental status, indicated by keywords like sudden change, confusion, and disorientation, is a significant symptom that could signal a serious medical problem. The CNA's most immediate and appropriate action is always to report such critical observations to the supervising nurse without delay, as the nurse has the training and authority to assess, diagnose, and intervene. For example, sudden confusion could indicate a urinary tract infection or a stroke, requiring prompt medical attention. Always remember that any acute change in a resident's condition needs immediate notification of the nurse. Question 2. When assisting a resident with dementia during mealtime, which approach is most effective? A. Rushing the resident to finish the meal quickly. B. Offering only one food item at a time. C. Providing a large, overwhelming plate of food. D. Insisting the resident use a fork, even if it's difficult. Answer: B. Offering only one food item at a time. This question focuses on providing person-centered care for residents with dementia, specifically during meals. The keyword "most effective" directs you to choose the best strategy. For individuals with dementia, too many choices or too much stimulation can be overwhelming and lead to refusal to eat. Offering one food item at a time simplifies the process and reduces confusion. For instance, instead of a plate with meat, potatoes, and vegetables all at once, offer a small portion of meat, wait until it's eaten, then offer the potatoes. Taking a patient, calm approach helps ensure the resident receives adequate nutrition. Question 3. Before performing any procedure, a CNA must always identify the resident. What is the most reliable way to do this? A. Call the resident by name and ask, "Are you resident's name?" B. Check the resident's name band against the care plan or assignment sheet. C. Ask the resident's roommate for confirmation. D. Look at the name on the door of the resident's room. Answer: B. Check the resident's name band against the care plan or assignment sheet. This question is about patient safety and proper identification, a fundamental skill for CNAs. The keyword "most reliable" indicates you should choose the method least prone to error. The most dependable way to identify a resident is by comparing the name on their identification (ID) band with the name listed on the resident's care plan or your assignment sheet, ensuring you have the correct person for the correct procedure. For example, before giving a resident a bath, you would check their ID band to confirm you are with the right individual. Always verify identity with at least 2 identifiers to prevent errors and ensure safety. Question 4. A CNA is preparing to transfer a resident from the bed to a wheelchair. What is the first action the CNA should take after explaining the procedure to the resident? A. Place the wheelchair at the bedside. B. Ensure the bed wheels are locked. C. Ask the resident to stand up. D. Raise the head of the bed. Answer: B. Ensure the bed wheels are locked. This question tests your understanding of safe transfer techniques and patient safety. The keyword "first action" after explaining the procedure highlights the immediate priority. Before any transfer, it is critical to ensure that both the bed wheels and the wheelchair wheels are locked to prevent accidental movement and falls during the transfer. This foundational step provides stability for the resident and the CNA. For instance, if the bed moves while the resident is attempting to stand, they could lose balance and fall. Always prioritize locking equipment wheels before initiating any transfer to ensure a stable and secure environment. Question 5. A resident has rights under the Omnibus Budget Reconciliation Act, OBRA. Which of the following is an example of a resident's right? A. The right to have personal belongings searched regularly. B. The right to be restrained if they are agitated. C. The right to participate in their care planning. D. The right to be isolated if they have an infectious disease. Answer: C. The right to participate in their care planning. This question addresses resident rights, a cornerstone of ethical care and a key component of OBRA, Omnibus Budget Reconciliation Act. The phrase resident's right asks you to identify a privilege protected by law. OBRA ensures that residents have the right to be involved in decisions about their care, including developing their care plan, promoting autonomy and dignity. For example, a resident should be able to choose what time they prefer to bathe or what activities they want to participate in, rather than having choices made for them. Empowering residents in their care promotes a sense of control and respect. Question 6. What is the most accurate way for a CNA to measure a resident's respiration rate? A. Count breaths for 15 seconds and multiply by 4. B. Count breaths for 30 seconds and multiply by 2. C. Count breaths for a full 60 seconds. D. Count breaths for 10 seconds and multiply by 6. Answer: C. Count breaths for a full 60 seconds. This question is about accurately measuring vital signs, specifically respirations. The keyword most accurate way asks for the most reliable method. To get the most precise respiration rate, it is recommended to count the breaths for a full minute, 60 seconds, because breathing patterns can be irregular or fluctuate, especially if the resident is aware they are being observed. For example, a person's breathing might speed up or slow down if they know someone is watching, making a shorter count less representative. Counting for a full minute provides the most reliable data. Question 7. A resident starts choking while eating. The CNA should first: A. Go get the nurse immediately. B. Ask the resident, "Are you choking?" C. Perform abdominal thrusts, Heimlich maneuver. D. Offer the resident a glass of water. Answer: B. Ask the resident, "Are you choking?" This question tests your knowledge of immediate actions during a choking emergency. The keyword first is crucial, directing you to the initial step in the choking protocol. The very first action is to determine if the resident is truly choking and if they can speak or cough, which indicates a partial airway obstruction. Asking, "Are you choking?" helps assess the severity. If they can speak, they might be able to clear it themselves, but if they cannot, it indicates a complete obstruction requiring further intervention like abdominal thrusts. Never offer water to someone who might be choking, as it could worsen the situation. Question 8. Which of the following is a sign of neglect by a caregiver? A. Resident's room is clean and tidy. B. Resident is well-groomed and dressed appropriately. C. Resident has unexplained weight loss and poor hygiene. D. Resident actively participates in facility activities. Answer: C. Resident has unexplained weight loss and poor hygiene. This question focuses on recognizing signs of abuse or neglect, a vital responsibility for CNAs. The keyword sign of neglect points to indicators that care is not being properly provided. Unexplained weight loss, poor hygiene, and untreated bed sores are classic physical signs that a resident's basic needs are not being met by their caregivers. For example, if a resident consistently appears unwashed, has matted hair, or wears soiled clothing, it suggests they are not receiving necessary personal care. Recognizing these signs and reporting them is critical to protecting residents. Question 9. When should a CNA document care provided to a resident? A. At the end of the shift. B. As soon as possible after the care is given. C. When the nurse reminds them. D. Before the care is provided. Answer: B. As soon as possible after the care is given. This question emphasizes the importance of accurate and timely documentation in healthcare. The keyword when should asks for the best practice regarding charting. Documentation should be done as soon as possible after care is provided to ensure accuracy and to reflect the resident's current condition and interventions, preventing details from being forgotten or misrepresented. For example, if you bathe a resident at 9 a.m., you should chart it shortly after, not wait until 3 p.m. when your shift ends, to avoid errors or omissions. Timely documentation is crucial for clear communication among the healthcare team. Question 10. A resident with dysphagia, difficulty swallowing, is at high risk for which complication? A. Diarrhea. B. Skin breakdown. C. Aspiration. D. Constipation. Answer: C. Aspiration. This question tests your understanding of medical terminology and associated risks, particularly for residents with swallowing difficulties. The term dysphagia is the key medical term, meaning difficulty swallowing. Residents with dysphagia are at high risk for aspiration, which occurs when food, liquid, or saliva enters the airway instead of going down the esophagus into the stomach, potentially leading to pneumonia. For example, if a resident with dysphagia is given thin liquids without proper thickening, they might cough and choke, indicating aspiration. Always be vigilant for signs of aspiration when assisting residents with dysphagia. Question 11. What is the purpose of regular repositioning for a bedridden resident? A. To increase their muscle strength. B. To prevent pressure injuries, bed sores. C. To improve their appetite. D. To encourage social interaction. Answer: B. To prevent pressure injuries, bed sores. This question focuses on the essential aspect of preventative care for bedridden residents. The keyword purpose asks why a specific action is performed. Regular repositioning, typically every 2 hours, is critical for bedridden residents to relieve pressure on bony areas of the body, which helps prevent the development of pressure injuries, also commonly known as bed sores or decubitus ulcers. For example, if a resident lies on their back for too long, pressure can build up on their tailbone, leading to skin breakdown. Turning residents frequently promotes circulation and protects skin integrity. Question 12. A CNA notices that a resident who is normally very social and talkative has become withdrawn and is spending all their time in their room. What should the CNA do? A. Encourage the resident to participate in an activity. B. Tell the resident to cheer up. C. Report the change in behavior to the nurse. D. Ignore it, assuming the resident wants to be alone. Answer: C. Report the change in behavior to the nurse. This question emphasizes the CNA's role in observing and reporting changes in a resident's condition, specifically behavioral changes. The keywords normally very social and talkative and become withdrawn highlight a significant shift in the resident's usual behavior. Any noticeable change in a resident's physical or mental state, including their mood or social habits, should be reported promptly to the nurse for assessment, as it could indicate depression, illness, or another underlying issue. For example, a sudden withdrawal could be a sign of pain or a new medication side effect. Your observations are valuable, so always report what seems out of the ordinary. Question 13. When assisting a resident with perineal care, the CNA should always wipe. A. From back to front. B. From front to back. C. Using a circular motion. D. In any direction, as long as it's clean. Answer: B. From front to back. This question tests a fundamental principle of infection control during personal care. The key is knowing the correct direction for wiping during perineal care. Wiping from front to back, from the urethra/vagina towards the anus, is essential to prevent the spread of bacteria from the anal area to the urinary tract, which could cause a urinary tract infection, UTI. For instance, when assisting a female resident with toileting, always ensure that each wipe stroke goes away from the urethra to avoid contamination. This simple technique significantly reduces the risk of infection. Question 14. What is the correct procedure for emptying a urinary drainage bag? A. Empty it only when it is completely full. B. Empty it every 24 hours, regardless of fullness. C. Open the clamp, allow urine to flow into a graduated container, and close the clamp without touching the spout. D. Touch the spout to the graduated container to prevent splashing. Answer: C. Open the clamp, allow urine to flow into a graduated container, and close the clamp without touching the spout. This question is about proper infection control and procedure when managing a urinary catheter. The correct method for emptying a drainage bag involves opening the clamp and allowing the urine to flow into a graduated container without touching the spout to the container, which prevents contamination. This sterile technique helps prevent bacteria from entering the drainage system and causing an infection. For example, after measuring the urine, you would then clean the spout with an alcohol wipe before reclamping it. Always maintain strict infection control practices when handling bodily fluids. Question 15. A resident requests pain medication. What is the CNA's appropriate response? A. Tell the resident to wait until the nurse makes rounds. B. Offer the resident a warm blanket or reposition them. C. Inform the nurse immediately about the resident's request. D. Suggest that pain is normal for their condition. Answer: C. Inform the nurse immediately about the resident's request. This question addresses the scope of practice for a CNA regarding medication administration and pain management. The keywords pain medication and appropriate response are crucial. CNAs are not permitted to administer medication, but they are responsible for observing and reporting residents' needs. Therefore, if a resident requests pain medication, the CNA must immediately report this to the nurse, who can then assess the pain and administer the appropriate medication. For example, if a resident complains of a headache, you would tell the nurse right away so they can assess the situation and provide relief. Always remember that pain is subjective, and residents have the right to have their pain addressed. Question 16. What is the primary reason for encouraging a resident to perform activities of daily living, ADLs, as independently as possible? A. To save the CNA time. B. To promote their self-esteem and independence. C. To demonstrate their ability to the family. D. To ensure they get enough exercise. Answer: B. To promote their self-esteem and independence. This question focuses on the philosophy behind restorative care and resident independence. The keyword primary reason asks for the most important goal. Encouraging residents to do as much as they can for themselves, even if it takes longer, helps maintain their existing abilities, boosts their self-esteem, and promotes a sense of independence and dignity. For example, instead of fully dressing a resident, you might offer assistance only with buttons if they can manage the rest, allowing them to participate in their own care. Supporting independence is central to person-centered care. Question 17. When applying a gait belt to a resident, where should it be placed? A. Around the resident's chest. B. Directly over the resident's waist, over clothing. C. Below the resident's hips. D. Loosely around the resident's abdomen, under clothing. Answer: B. Directly over the resident's waist, over clothing. This question tests your practical knowledge of using assistive devices for safe transfers. The correct placement of a gait belt is crucial for safety. A gait belt should be applied snugly over the resident's clothing at the waist, allowing enough room for 2 fingers to fit underneath, which provides a secure grasp for the CNA during transfers or ambulation. For example, before helping a resident stand, you would ensure the gait belt is correctly positioned and tightened to provide proper support without restricting breathing. Proper gait belt application prevents falls and protects both the resident and the CNA. Question 18. What is the term for a legal document that allows a person to make decisions about another person's medical care if they become unable to make decisions for themselves? A. Will. B. Durable power of attorney for healthcare. C. Living trust. D. Birth certificate. Answer: B. Durable power of attorney for healthcare. This question delves into legal and ethical aspects of resident care, specifically advance directives. The term legal document that allows someone else to make medical decisions for an incapacitated person is a durable power of attorney for healthcare, POACH, or sometimes called a healthcare proxy. This document designates a specific individual to act as the resident's healthcare agent, ensuring their wishes are honored even if they cannot communicate. For example, if a resident becomes unconscious, their designated POACH can make decisions about their treatment based on their previously expressed wishes. Understanding these documents is vital for respecting resident autonomy. Question 19. A resident's care plan states NPO. What does this mean? A. The resident needs a high-protein diet. B. The resident can have liquids only. C. The resident is not allowed anything by mouth. D. The resident needs assistance with feeding. Answer: C. The resident is not allowed anything by mouth. This question tests your understanding of common medical abbreviations found in care plans. NPO is a widely used medical abbreviation derived from the Latin nil per os, which means nothing by mouth. This instruction is critical for residents who may be preparing for surgery, diagnostic tests, or have a severe swallowing impairment, to prevent aspiration or complications. For example, if a resident is NPO for a procedure, they cannot even have ice chips or water. Following NPO orders strictly is essential for resident safety. Question 20. When providing personal care, what should a CNA do to ensure a resident's privacy? A. Keep the room door slightly ajar. B. Pull the privacy curtain around the bed. C. Talk loudly during the procedure. D. Allow visitors to stay in the room. Answer: B. Pull the privacy curtain around the bed. This question highlights the importance of respecting resident dignity and privacy during care. The keyword privacy is central here. The most effective way to ensure a resident's privacy during personal care, such as bathing or dressing, is to close the door and pull the privacy curtain around the bed, creating a private space for the resident. For example, before assisting a resident with a bed bath, you would always close the door and draw the curtain to shield them from view and noise. Respecting privacy builds trust and maintains resident dignity. Question 21. What is the normal range for an adult's oral temperature? A. 96.6 degrees Fahrenheit to 97.6 degrees Fahrenheit. B. 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit. C. 99.6 degrees Fahrenheit to 100.6 degrees Fahrenheit. D. 100.6 degrees Fahrenheit to 102.6 degrees Fahrenheit. Answer: B. 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit. This question tests your knowledge of normal vital sign ranges, specifically oral temperature. Understanding typical ranges helps you identify when a resident's condition might be abnormal and requires reporting. The normal oral temperature for an adult typically falls within the range of 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, 36.5 degrees Celsius to 37.5 degrees Celsius. Any reading significantly outside this range, especially a fever, should be reported to the nurse immediately for further assessment. For example, a reading of 100.8 degrees Fahrenheit would indicate a fever and needs to be reported. Knowing these ranges helps you recognize potential health issues. Question 22. A CNA is assisting a resident who has a weak side due to a stroke. When dressing the resident, which arm should be dressed first? A. The resident's strong arm. B. The resident's weak arm. C. Either arm, it does not matter. D. The arm closest to the CNA. Answer: B. The resident's weak arm. This question addresses providing care for residents with physical limitations, specifically when dressing. The key is remembering the principle for dressing a resident with a weak side: dress the weak side first. This approach makes it easier to manipulate clothing over the less mobile limb and helps prevent pain or injury to the affected side. For example, when putting on a shirt, you would guide the weak arm through the sleeve first, then the strong arm. Undressing is the opposite: undress the strong side first. Question 23. What does ROM stand for in a resident's care plan? A. Rest on mattress. B. Range of motion. C. Room-only movement. D. Resident's own medication. Answer: B. Range of motion. This question tests your knowledge of common medical abbreviations used in care plans, specifically related to physical activity. ROM stands for range of motion, which refers to the extent to which a joint can be moved. Range of motion exercises are performed to prevent stiffness, contractures, permanent tightening of muscles or joints, and to maintain flexibility in residents, especially those who are immobile. For example, the care plan might state assist with ROM exercises to upper and lower extremities, meaning the CNA should help move the resident's arms and legs through their full range of movement. Question 24. What is the most effective way to prevent the spread of infection? A. Wearing gloves at all times. B. Using hand sanitizer frequently. C. Washing hands thoroughly with soap and water. D. Avoiding contact with residents who are sick. Answer: C. Washing hands thoroughly with soap and water. This question focuses on the most fundamental aspect of infection control. While gloves and hand sanitizer are important, the keyword most effective points to the gold standard. The single most effective way to prevent the spread of infection is frequent and thorough hand washing with soap and water for at least 20 seconds, especially after contact with bodily fluids, before and after resident care, and after using the restroom. For example, you should wash your hands before putting on gloves, and again immediately after removing them, even if the gloves appear clean. Proper hand hygiene is the cornerstone of safe patient care. Question 25. A CNA is assisting a resident with eating who suddenly begins coughing violently. What should the CNA do first? A. Encourage the resident to keep coughing. B. Immediately perform abdominal thrusts. C. Offer the resident a drink of water. D. Leave the room to find a nurse. Answer: A. Encourage the resident to keep coughing. This question addresses the immediate response to a resident who is coughing during a meal. The keyword first is critical here. If a resident is coughing violently but still able to make sounds, it usually means they have a partial airway obstruction and their body is trying to clear it on its own. The best initial action is to encourage them to keep coughing, as this is the most effective way for them to clear their own airway. Only if they stop coughing, cannot speak, or show signs of complete obstruction should you intervene with abdominal thrusts. Question 26. What does ADLs refer to in healthcare? A. Activities done leisurely. B. Acute disease log. C. Activities of daily living. D. Assisted daily living support. Answer: C. Activities of daily living. This question tests your knowledge of common healthcare acronyms, specifically one that is central to CNA duties. ADL stands for Activities of Daily Living, which are the basic self-care tasks that people perform daily, such as bathing, dressing, eating, toileting, and ambulating. CNAs provide significant assistance with these tasks to residents who are unable to perform them independently. For example, assisting a resident with brushing their teeth, combing their hair, or helping them use the toilet are all examples of ADL assistance. Understanding ADLs is fundamental to understanding a CNA's role. Question 27. When measuring a resident's pulse, which site is most commonly used for a routine check? A. Carotid artery, neck. B. Brachial artery, inner elbow. C. Radial artery, wrist. D. Femoral artery, groin. Answer: C. Radial artery, wrist. This question asks about the common practice for taking a routine pulse. The keyword most commonly used refers to the preferred site for a regular pulse check. The radial artery, located on the thumb side of the wrist, is the most common and convenient site for routinely measuring an adult's pulse due to its accessibility and distinct pulsation. For example, when you take a resident's vital signs, you would typically place 2 fingers on their radial artery to count the heartbeats. While other sites exist, the radial pulse is standard for routine assessment. Question 28. What is the correct way to respond if a resident accuses you of stealing their personal item? A. Immediately defend yourself and deny the accusation. B. Search the resident's room for the item. C. Report the accusation to the nurse immediately. D. Tell the resident they must be mistaken. Answer: C. Report the accusation to the nurse immediately. This question explores the appropriate professional response to serious accusations. The keyword correct way to respond emphasizes the protocol to follow. If a resident accuses a CNA of stealing, it is a serious accusation that must be reported immediately to the nurse or supervisor. The CNA should not attempt to resolve the situation independently or become defensive, as this is a matter for management to investigate. For example, if a resident claims their ring is missing and points to you, your immediate step is to notify the nurse so they can follow facility policy for investigations. Your role is to report, not to investigate or accuse. Question 29. A resident expresses a desire to participate in religious services but has difficulty ambulating. What should the CNA do? A. Tell the resident it's too difficult to arrange. B. Inform the resident that services are only for independent residents. C. Assist the resident to attend or help arrange for spiritual support. D. Suggest they watch a religious program on TV instead. Answer: C. Assist the resident to attend or help arrange for spiritual support. This question addresses resident rights and providing person-centered care, specifically regarding spiritual needs. Residents have the right to practice their religion and participate in religious services. The CNA's role is to facilitate this right if possible. If a resident expresses a desire to attend, the CNA should offer assistance to help them attend or, if that's not feasible, report their wish to the nurse so that other arrangements for spiritual support can be made. For example, if the facility has a chapel service, you would help transport the resident safely there, or help them connect with a chaplain if they prefer. Respecting spiritual needs is part of holistic care. Question 30. What is a care plan in a nursing facility? A. A daily list of tasks for the CNA to complete. B. A legal document outlining the facility's policies. C. A written guide that provides direction for a resident's care. D. A financial record of the resident's expenses. Answer: C. A written guide that provides direction for a resident's care. This question defines a core tool used in resident care. A care plan is a written document developed by the healthcare team that outlines a resident's specific needs, problems, and the interventions, actions, required to address them. It serves as a comprehensive guide for all caregivers, ensuring consistent and individualized care. For example, a care plan might detail a resident's dietary restrictions, bathing schedule preferences, or specific assistance needed with transfers. Following the care plan is essential for providing effective and coordinated care. Question 31. When assisting a resident with oral hygiene who wears dentures, what should the CNA remember? A. Dentures should be cleaned with hot water to sanitize them. B. Dentures should be scrubbed with a regular toothbrush. C. Dentures should be handled carefully to avoid breakage and kept in a labeled cup with cool water when not in use. D. Dentures should only be cleaned by the resident themselves. Answer: C. Dentures should be handled carefully to avoid breakage and kept in a labeled cup with cool water when not in use. This question pertains to providing personal care, specifically oral hygiene for residents with dentures. The correct handling of dentures is crucial to prevent damage and ensure proper hygiene. Dentures are fragile and expensive, so they must be handled carefully, never with hot water, which can warp them, and always stored in a labeled cup with cool water or a denture cleaning solution when not being worn to prevent drying out and warping. For example, after removing a resident's dentures for cleaning, you would place them in a labeled cup immediately while you brush them, then return them to the cup if the resident isn't putting them back in right away. Proper care extends their life and maintains resident comfort. Question 32. Which action promotes a resident's independence during mealtime? A. Feeding the resident completely to ensure they finish. B. Cutting all the resident's food into small pieces before serving. C. Allowing the resident to use their hands to eat if they prefer and it's safe. D. Insisting the resident use utensils even if they struggle. Answer: C. Allowing the resident to use their hands to eat if they prefer and it's safe. This question focuses on empowering residents during mealtime, a critical aspect of person-centered care. The keyword promotes independence guides you to the choice that fosters autonomy. For some residents, especially those with dexterity issues or dementia, using their hands to eat may be the safest and most independent way for them to consume food. As long as it is safe, clean, and respectful of their dignity, allowing this choice supports their ability to feed themselves. For example, offering finger foods like chicken nuggets or sandwich halves can enable a resident to eat independently when using utensils is too difficult. Question 33. What is the primary purpose of hospice care? A. To cure a terminal illness. B. To provide aggressive treatment for life-threatening conditions. C. To provide comfort and support to individuals with a terminal illness and their families. D. To rehabilitate individuals after a major injury. Answer: C. To provide comfort and support to individuals with a terminal illness and their families. This question defines the core philosophy and purpose of hospice care. The keyword primary purpose directs you to its main goal. Hospice care is specifically designed to provide palliative care, which means comfort care, and support to individuals who have a terminal illness with a limited life expectancy, focusing on quality of life rather than curative treatment. For example, hospice care ensures a resident is free from pain, maintains dignity, and provides emotional support to both the resident and their family during their final stages of life. It emphasizes living life fully until the very end. Question 34. A CNA notices a small red area on a resident's sacrum that does not blanch, turn white, when touched. What should the CNA do? A. Apply a bandage to the area. B. Vigorously rub the area to increase circulation. C. Reposition the resident and report the observation to the nurse immediately. D. Document it at the end of the shift. Answer: C. Reposition the resident and report the observation to the nurse immediately. This question is critical for identifying and responding to early signs of skin breakdown, specifically pressure injuries. The keywords small red area, sacrum, and does not blanch are classic indicators of a stage 1 pressure injury. The immediate and appropriate action is to relieve the pressure by repositioning the resident and promptly reporting the observation to the nurse, who can assess it further and initiate interventions. For example, if you see this on a resident's lower back, you would immediately turn them onto their side and tell the nurse so they can assess and order appropriate treatment to prevent worsening. Early detection and reporting are key to preventing serious skin damage. Question 35. Which of the following best describes the role of a CNA in the care team? A. Diagnosing medical conditions. B. Administering medications. C. Providing direct personal care and assisting nurses with medical tasks. D. Performing surgical procedures. Answer: C. Providing direct personal care and assisting nurses with medical tasks. This question clarifies the scope of practice for a certified nursing assistant. The keyword role asks for the primary responsibilities. CNAs are vital members of the healthcare team who primarily provide direct personal care, such as assistance with ADLs, and assist nurses with various medical tasks like taking vital signs, observing residents, and collecting specimens, all under the supervision of a licensed nurse. For example, a CNA helps a resident with bathing and dressing, then reports a change in their breathing to the nurse. CNAs do not diagnose, administer medications, or perform invasive procedures. Question 36. What is the proper way to lift a resident to prevent injury to the CNA's back? A. Lift with your back, keeping your legs straight. B. Bend at your waist and twist while lifting. C. Use your legs, keep your back straight, and get help if needed. D. Lift with a jerking motion to gain momentum. Answer: C. Use your legs, keep your back straight, and get help if needed. This question tests your knowledge of proper body mechanics, which is essential for preventing injuries to both the CNA and the resident. The keywords proper way to lift and prevent injury highlight safe practice. The correct method for lifting involves bending at your knees and hips, using your legs, rather than your waist, keeping your back straight, and engaging your core muscles, while always seeking assistance if the resident is heavy or difficult to move. For example, when helping a resident from a chair, squat down, keep your back straight, and push up with your leg muscles. Always protect your back by using proper body mechanics. Question 37. A resident with Alzheimer's disease frequently wanders. What is the most appropriate action for the CNA? A. Restrain the resident to prevent wandering. B. Lock the resident in their room. C. Provide a safe and supervised environment for ambulation. D. Scold the resident for wandering. Answer: C. Provide a safe and supervised environment for ambulation. This question addresses providing care for residents with Alzheimer's disease, specifically managing wandering behavior. The keywords frequently wanders and most appropriate action direct you to a person-centered, safety-focused solution. Wandering is often a characteristic of Alzheimer's, and the most appropriate response is to ensure a safe environment where the resident can move freely but supervised, preventing harm while respecting their need for movement. For example, a facility might have secured wandering paths or provide engaging activities to redirect energy, ensuring the resident is safe while walking. Restraints are generally prohibited and often increase agitation. Question 38. What is the purpose of donning, putting on, personal protective equipment, PPE, like gloves, gowns, and masks. A. To keep the CNA's uniform clean. B. To protect the CNA from exposure to pathogens and prevent their spread. C. To make the resident feel more comfortable. D. To meet aesthetic standards of the facility. Answer: B. To protect the CNA from exposure to pathogens and prevent their spread. This question focuses on the fundamental reason for using personal protective equipment, PPE, in healthcare. The purpose of PPE, such as gloves, gowns, and masks, is primarily to create a barrier between healthcare workers and infectious agents, pathogens, protecting the CNA from exposure and preventing the spread of microorganisms from one person to another. For example, wearing gloves when handling bodily fluids protects your skin from contamination and prevents you from carrying germs to another resident. PPE is a crucial component of infection control and worker safety. Question 39. A resident is refusing to eat their meal. What should the CNA do first? A. Force the resident to eat. B. Take the tray away immediately. C. Determine the reason for refusal, offer alternatives, and report to the nurse. D. Document the refusal without further action. Answer: C. Determine the reason for refusal, offer alternatives, and report to the nurse. This question addresses managing mealtime challenges and resident rights. The keyword first is important, guiding you to the initial, most appropriate response. When a resident refuses to eat, the CNA should first try to understand why, as there could be many reasons, e.g., pain, dislike of food, difficulty chewing/swallowing. Offering alternatives or waiting a short period might help, and then promptly reporting the refusal to the nurse is essential for dietary and care planning. For example, if a resident says, "I don't like peas," you might ask if they prefer carrots instead, then report the overall intake to the nurse. Never force a resident to eat. Question 40. Before assisting a resident to ambulate, what should the CNA always check? A. The resident's personal financial records. B. The resident's family visitation schedule. C. The resident's care plan for specific ambulation instructions and precautions. D. The television schedule for the resident's favorite show. Answer: C. The resident's care plan for specific ambulation instructions and precautions. This question emphasizes the importance of following the care plan and ensuring resident safety, especially concerning mobility. Before assisting a resident with ambulation, walking, the CNA must always consult the resident's care plan. This plan contains vital information regarding their weight-bearing status, required assistance level, use of assistive devices, like a walker or cane, and any specific precautions to ensure safe and individualized care. For example, a care plan might indicate one person assist with gait belt or non-weight bearing on left leg, which drastically affects how you assist them. Always review the care plan to ensure safety. Question 41. What is the legal term for hitting a resident? A. Battery. B. Assault. C. False imprisonment. D. Slander. Answer: A. Battery. This question tests your understanding of legal terms related to abuse. The keyword hitting directly points to the definition of battery. Battery is the legal term for the intentional physical touching of another person without their consent, even if no harm is intended. Assault, in contrast, is the threat of physical harm. Any act of physical violence against a resident, such as hitting, kicking, or pushing, constitutes battery and is a serious form of abuse. CNAs have a legal and ethical responsibility to protect residents from battery and all forms of abuse. Question 42. When providing a bed bath, how should the CNA clean the resident's eyes? A. Using soap and water. B. Wiping from outer corner to inner corner. C. Using a different part of the washcloth for each eye, wiping from inner corner to outer corner. D. Skipping the eyes, as they clean themselves. Answer: C. Using a different part of the washcloth for each eye, wiping from inner corner to outer corner. This question pertains to proper hygiene and infection control during a bed bath. The correct technique for cleaning a resident's eyes involves using a clean, wet washcloth, without soap, and wiping from the inner corner, near the nose, to the outer corner of the eye, using a fresh section of the cloth or a new cloth for each eye. This method prevents the spread of infection from one eye to the other and from the eye to other parts of the face. For example, you would fold the washcloth and use a distinct, clean part for the right eye, then fold it again to use a different clean part for the left eye. Question 43. What is the normal range for an adult's blood pressure? A. 90/60 mmHg to 110/70 mmHg. B. 120/80 mmHg to 140/90 mmHg. C. 100/60 mmHg to 120/80 mmHg. D. 140/90 mmHg to 160/100 mmHg. Answer: C. 100/60 mmHg to 120/80 mmHg. This question tests your knowledge of normal vital sign ranges, specifically blood pressure. Understanding typical ranges helps you identify when a resident's condition might be abnormal and requires reporting. The normal blood pressure for an adult is generally considered to be less than 120/80 mmHg, with a common healthy range falling between 100/60 mmHg and 120/80 mmHg. For example, a reading of 95/55 mmHg or 130/85 mmHg would need to be reported to the nurse, as both are outside the normal optimal range and could indicate potential issues. Question 44. A CNA notices that a resident's colostomy bag is full. What is the CNA's immediate action? A. Change the entire colostomy bag and wafer. B. Clamp the colostomy bag. C. Empty the contents of the colostomy bag into a graduated container. D. Call the resident's family to inform them. Answer: C. Empty the contents of the colostomy bag into a graduated container. This question concerns the practical care of a resident with a colostomy. When a colostomy bag is full, the immediate action for a CNA is to empty its contents into a graduated container, usually when it is 1/3 to 1/2 full, to prevent it from leaking or becoming too heavy. Changing the entire bag and wafer is a different procedure performed less frequently. For example, if a resident's bag is visibly bulging, you would take it to the bathroom, open the clamp at the bottom, and drain the stool into a measuring container, then rinse and reclamp the bag. Question 45. What is the purpose of encouraging a resident to deep breathe and cough after surgery? A. To prevent constipation. B. To strengthen abdominal muscles. C. To prevent pneumonia and other respiratory complications. D. To improve circulation in the legs. Answer: C. To prevent pneumonia and other respiratory complications. This question focuses on postoperative care and its rationale. The keyword purpose asks why deep breathing and coughing exercises are performed. After surgery, residents are at increased risk for respiratory complications like pneumonia, inflammation of the lungs, due to reduced lung expansion and fluid buildup. Deep breathing and coughing exercises help clear the airways, expand the lungs, and prevent these complications. For example, you would instruct a resident to take a slow, deep breath, hold it for a few seconds, and then cough strongly to help clear secretions. Question 46. A resident reports blurred vision and increased thirst. These symptoms might indicate: A. Low blood pressure. B. Hypoglycemia, low blood sugar. C. Hyperglycemia, high blood sugar. D. Dehydration. Answer: C. Hyperglycemia, high blood sugar. This question tests your ability to recognize common signs of medical conditions. The symptoms blurred vision and increased thirst are classic signs of hyperglycemia, or high blood sugar, often associated with diabetes. This combination of symptoms indicates a potential medical emergency or worsening of a chronic condition, requiring immediate reporting to the nurse for assessment and intervention. For example, if a resident with diabetes reports these symptoms, the nurse may need to check their blood sugar and administer insulin. Recognizing these clues helps ensure timely care. Question 47. When a resident is receiving oxygen therapy via a nasal cannula, what is the CNA's responsibility? A. To adjust the oxygen flow rate as needed. B. To remove the cannula during meals. C. To ensure the tubing is not kinked and the prongs are correctly inserted. D. To document the resident's oxygen saturation levels. Answer: C. To ensure the tubing is not kinked and the prongs are correctly inserted. This question addresses the CNA's role in caring for residents on oxygen therapy. While CNAs do not adjust oxygen flow rates, that's for the nurse, their responsibility includes ensuring the safe and effective delivery of oxygen. This means checking that the tubing is free of kinks, the nasal prongs are properly inserted into the nostrils, and the resident's skin around the ears and nose is free from irritation or pressure sores. For example, you would regularly check to see if the oxygen tubing is caught under the bed rails or if the prongs are causing redness on the resident's nostrils. Question 48. What is the term for a sudden drop in blood pressure when a person stands up, leading to dizziness or fainting? A. Hypertension. B. Orthostatic hypotension. C. Tachycardia. D. Bradycardia. Answer: B. Orthostatic hypotension. This question asks for a specific medical term related to vital signs and patient safety. The description, sudden drop in blood pressure when a person stands up, leading to dizziness or fainting, perfectly defines orthostatic hypotension, also known as postural hypotension. This condition is common in elderly residents and can significantly increase the risk of falls. For example, if a resident complains of dizziness right after standing from a lying position, you should suspect orthostatic hypotension and help them sit or lie down to prevent a fall. Always assist residents to stand slowly and pause to check for dizziness. Question 49. When transferring a resident using a mechanical lift, what is the most important safety check? A. Ensuring the resident's hair is neatly combed. B. Making sure the lift is fully charged. C. Checking that the sling is securely attached to the lift and the resident is properly positioned in the sling. D. Confirming the resident has had their breakfast. Answer: C. Checking that the sling is securely attached to the lift and the resident is properly positioned in the sling. This question focuses on safety procedures for using mechanical lifts, which are critical for preventing falls and injuries. The keyword "most important safety check" points to the absolute priority. Before lifting, always ensure the sling is correctly applied to the resident according to the manufacturer's instructions and securely attached to all hooks or clips on the lift, verifying the resident is properly positioned and balanced in the sling. For example, if even one loop of the sling is not properly hooked, the resident could fall. Proper attachment and positioning are paramount to safe mechanical lift transfers. Question 50. A resident is expressing feelings of loneliness and sadness. What is the most appropriate response from the CNA? A. Tell them to cheer up and smile. B. Change the subject to something more positive. C. Listen actively, acknowledge their feelings, and report to the nurse. D. Leave the room to give them space. Answer: C. Listen actively, acknowledge their feelings, and report to the nurse. This question addresses therapeutic communication and responding to a resident's emotional needs. When a resident expresses negative emotions like loneliness or sadness, the most appropriate action is to listen actively and empathetically, acknowledging their feelings without judgment, and then report these observations to the nurse. The nurse can then assess for depression or other issues and plan appropriate interventions. For example, you might say, "It sounds like you're feeling lonely today," and then make sure the nurse is aware so they can provide further support or suggest activities. Question 51. What is the main reason for strict adherence to food and fluid restrictions for residents? A. To save on facility costs. B. To allow the resident to lose weight quickly. C. To prevent complications and manage medical conditions. D. To encourage the resident to be more active. Answer: C. To prevent complications and manage medical conditions. This question emphasizes the medical importance of dietary compliance. The keyword main reason highlights the critical purpose. Food and fluid restrictions are prescribed by doctors for specific medical reasons, such as managing heart failure, fluid restrictions, kidney disease, protein or potassium restrictions, or dysphagia, thickened liquids. Strict adherence is essential to prevent serious complications and effectively manage the resident's underlying medical condition. For example, a resident with congestive heart failure on a fluid restriction could experience dangerous fluid overload if they drink too much water. Always follow dietary orders precisely as written in the care plan. Question 52. What does BID mean in a medication order or care plan? A. Once a day. B. Twice a day. C. 3 times a day. D. At bedtime. Answer: B. Twice a day. This question tests your knowledge of common medical abbreviations related to medication schedules. BID is a Latin abbreviation for bis in die, meaning twice a day. This abbreviation is frequently used in care plans and medication orders to indicate how often a particular intervention or medication should occur. For example, if a care plan states assist with ambulation BID, it means you should help the resident walk 2 times a day. Knowing these abbreviations is crucial for understanding and correctly following care instructions. Question 53. Which technique is appropriate for assisting a visually impaired resident to ambulate? A. Walking ahead of the resident and calling out directions. B. Walking slightly behind the resident and guiding them with a hand on their back. C. Walking slightly ahead of the resident, offering your arm, and describing the surroundings. D. Pushing the resident in a wheelchair without verbalizing. Answer: C. Walking slightly ahead of the resident, offering your arm, and describing the surroundings. This question addresses providing safe and respectful care for residents with sensory impairments. When assisting a visually impaired resident to walk, the appropriate technique is to walk slightly ahead of them, allowing them to hold onto your arm, usually just above the elbow, and act as their eyes by describing the environment and warning them of obstacles. For example, you would offer your arm and say, "We're approaching a step down now," or "The dining room entrance is on your left." This method allows them to feel secure and informed while maintaining their independence. Question 54. A resident becomes combative during care. What should the CNA do immediately? A. Raise your voice and demand compliance. B. Try to physically overpower the resident. C. Stop the care, ensure safety, and report to the nurse. D. Ignore the behavior and continue care quickly. Answer: C. Stop the care, ensure safety, and report to the nurse. This question addresses how to manage challenging behaviors and ensure safety in resident care. The keyword immediately highlights the priority. If a resident becomes combative, physically aggressive or resistant, during care, the CNA should immediately stop the procedure, step back to ensure their own safety and the resident's safety, and then report the incident to the nurse. Continuing care or trying to physically force a resident can escalate the situation and lead to injury. For example, if a resident hits your hand during a bath, you would calmly stop the bath, move to a safe distance, and tell the nurse about the incident. Question 55. What is the correct way to handle soiled linen? A. Shake it out before placing it in the linen hamper. B. Place it on the floor temporarily. C. Roll it inward, away from your uniform, and place it directly into a designated hamper. D. Carry it against your uniform to keep it contained. Answer: C. Roll it inward, away from your uniform, and place it directly into a designated hamper. This question focuses on infection control practices when handling contaminated materials. The correct method for handling soiled linen is to roll it inward, away from your body and uniform, and immediately place it into a designated, covered linen hamper or bag without shaking it. Shaking soiled linen can release airborne pathogens, and placing it on the floor or against your uniform risks spreading germs. For example, after changing a resident's soiled bed linens, you would carefully roll them into a ball, keeping the soiled side inward, and immediately drop them into the laundry bin. Question 56. When taking a resident's weight, what should the CNA ensure for accuracy? A. The resident is wearing their shoes. B. The resident is fully dressed. C. The scale is calibrated and the resident is wearing similar clothing and weighed at the same time of day. D. The resident has just eaten a large meal. Answer: C. The scale is calibrated and the resident is wearing similar clothing and weighed at the same time of day. This question addresses the importance of accurate measurements in resident assessment. To ensure an accurate weight, it's crucial to use a calibrated scale, weigh the resident at the same time each day, typically in the morning after voiding and before breakfast, and ensure they are wearing similar lightweight clothing. These factors minimize variations that could affect the reading. For example, weighing a resident fully clothed with shoes on one day and in a gown the next will give an inaccurate comparison. Consistency is key for reliable weight monitoring. Question 57. A resident has signed an advance directive stating they do not wish to be resuscitated, DNR. If the resident stops breathing, what is the CNA's immediate action? A. Begin CPR immediately. B. Call 911. C. Notify the nurse and provide comfort care. D. Ask the family if they want resuscitation. Answer: C. Notify the nurse and provide comfort care. This question tests your understanding of advanced directives and end-of-life care. The keyword DNR, do not resuscitate, means that if the resident stops breathing or their heart stops, no life-saving measures like CPR should be initiated. The CNA's immediate action is to notify the nurse and then provide comfort measures as per the resident's wishes and care plan, ensuring their dignity and peace. For example, if a DNR resident collapses, you would immediately alert the nurse, but you would not perform chest compressions. Respecting a DNR order is legally and ethically paramount. Question 58. What is the most common cause of falls in a long-term care facility? A. Overuse of restraints. B. Untied shoelaces. C. Environmental hazards like wet floors or clutter. D. Lack of proper lighting. Answer: C. Environmental hazards like wet floors or clutter. This question focuses on fall prevention, a critical safety concern in healthcare. While many factors contribute to falls, the keyword most common cause points to environmental factors. Slippery floors, poor lighting, cluttered pathways, and improperly placed furniture are frequently cited as the leading causes of falls in healthcare settings. For example, if a CNA sees a spill on the floor, they should clean it up immediately or place a wet floor sign to prevent someone from slipping. Maintaining a safe, clutter-free environment is essential for fall prevention. Question 59. When assisting a resident who is visually impaired with their meal, what is the best way to describe the food on the plate? A. Point to each item as you name it. B. Describe the food as if it were on a clock face. C. Tell them to use their fingers to feel the food. D. Just give them the tray and let them discover. Answer: B. Describe the food as if it were on a clock face. This question addresses providing respectful and practical assistance for residents with visual impairments during mealtime. The best way to describe food on a plate to a visually impaired resident is to use the clock face method, explaining where each item is located in relation to the center of the plate. For example, you might say, your meat is at 12 o'clock, potatoes at 3 o'clock, and green beans at 9 o'clock. This method allows the resident to easily locate items and maintain independence. Question 60. What is considered a restraint if used on a resident without a medical order? A. A gait belt used for ambulation assistance. B. A bed rail placed up on both sides of the bed for a confused resident. C. A special chair designed to prevent sliding. D. A seat belt on a wheelchair for transport. Answer: B. A bed rail placed up on both sides of the bed for a confused resident. This question delves into the proper use of restraints and resident rights. A restraint is any physical or chemical means used to restrict a resident's freedom of movement or access to their body, which cannot be easily removed by the resident. While bed rails can be used as safety devices, placing all four rails up, especially for a confused resident who cannot lower them, is often considered a restraint because it prevents them from getting out of bed freely, and requires a specific medical order. For example, if a resident is agitated and you put up both side rails to keep them in bed without a doctor's order, this would be considered an illegal restraint. Question 61. What should a CNA do if they discover a small fire in a resident's room? A. Open the windows to let the smoke out. B. Try to put out the fire with water. C. Follow the RACE acronym: rescue, alarm, contain, extinguish. D. Gather personal belongings before evacuating. Answer: C. Follow the RACE acronym: rescue, alarm, contain, extinguish. This question tests your knowledge of fire safety protocols. The RACE acronym is a widely recognized mnemonic for fire emergencies, guiding the CNA on the immediate steps to take. Rescue anyone in immediate danger. Alarm by activating the fire alarm and notifying the fire department/facility staff. Contain the fire by closing doors and windows, and extinguish if the fire is small and can be safely put out with a fire extinguisher, otherwise evacuate. For example, if you see flames in a wastebasket, you would first get the resident out of the room, pull the fire alarm, close the door, and then decide if it's safe to use a fire extinguisher. Question 62. Which vital sign provides information about the force of blood against the artery walls? A. Temperature. B. Pulse. C. Respiration. D. Blood pressure. Answer: D. Blood pressure. This question is about understanding what each vital sign measures. Blood pressure is the vital sign that specifically measures the force or pressure of circulating blood against the walls of the arteries as the heart pumps it. It provides two numbers: systolic, when the heart beats, and diastolic, when the heart rests between beats. For example, a reading of 120/80 mmHg indicates the pressure during heart contraction and relaxation. Understanding what each vital sign represents is fundamental to recognizing deviations and reporting them to the nurse. Question 63. A CNA needs to collect a urine specimen from a resident for a routine urinalysis. What is the best method? A. Collect urine directly from the resident's catheter bag. B. Ask the resident to void into a clean bedpan or urinal. C. Collect urine from the toilet bowl after the resident voids. D. Obtain the specimen from a Foley catheter by disconnecting the drainage bag. Answer: B. Ask the resident to void into a clean bedpan or urinal. This question tests your practical knowledge of specimen collection. For a routine urinalysis, analysis of urine, the best method is to ask the resident to void, urinate, into a clean, dry bedpan, urinal, or commode hat, ensuring the specimen is not contaminated by stool or other substances. Urine from a catheter bag is often not fresh enough for an accurate routine analysis, and collecting from a toilet bowl is highly contaminated. For example, you would provide a clean collection device and ensure the resident understands to urinate directly into it. Question 64. What is the purpose of post-mortem care? A. To prepare the body for burial. B. To ensure the resident's final wishes are met. C. To provide care for the body after death and prepare it for viewing or transport. D. To conduct an autopsy. Answer: C. To provide care for the body after death and prepare it for viewing or transport. This question explains a specific type of care provided after a resident's passing. Post-mortem care refers to the care provided to a resident's body immediately after death, which includes cleaning and positioning the body, preparing it for viewing by family members, and making it ready for transport to the morgue or funeral home. This respectful care helps maintain the dignity of the deceased and supports the grieving family. For example, you would close the resident's eyes, straighten their limbs, and clean their body as part of post-mortem care. Question 65. When assisting a resident who is hearing impaired, what is the most effective communication strategy? A. Shouting loudly at the resident. B. Speaking slowly and clearly, facing the resident. C. Turning on the TV loudly to get their attention. D. Writing everything down, even for simple questions. Answer: B. Speaking slowly and clearly, facing the resident. This question focuses on effective communication techniques for residents with sensory impairments. The keyword most effective points to the best strategy. When communicating with a hearing-impaired resident, it's best to speak slowly and clearly, using a normal tone of voice, avoiding shouting, and facing the resident so they can see your lips and facial expressions, which aids in understanding. For example, before speaking, you would ensure you have their attention and are directly in their line of sight. Good communication is key to providing person-centered care. Question 66. A CNA is assisting a resident with range of motion (ROM) exercises. If the resident complains of pain during an exercise, what should the CNA do? A. Continue the exercise to stretch the muscle. B. Stop the exercise immediately. C. Increase the speed of the movement. D. Ignore the complaint, as some discomfort is normal. Answer: B. Stop the exercise immediately. This question is about safe practice during therapeutic exercises. The key instruction is that if a resident complains of pain during range of motion exercises, the CNA must stop the exercise immediately. Pain is a signal that something is wrong and continuing could cause injury. After stopping, the CNA should report the pain to the nurse, who can assess the situation. For example, if a resident grimaces and says "ouch" when you move their arm, you would immediately stop moving their arm and tell the nurse. Always prioritize resident comfort and safety over completing the exercise. Question 67. What is the primary reason for encouraging fluid intake in residents? A. To increase their appetite. B. To prevent dehydration and constipation. C. To make them urinate more frequently. D. To dilute their medications. Answer: B. To prevent dehydration and constipation. This question asks about the importance of hydration in resident care. The keyword primary reason emphasizes the main benefit. Encouraging adequate fluid intake is crucial to prevent dehydration, which can lead to various complications like confusion, low blood pressure, and kidney problems, and to prevent constipation, as fluids help keep stools soft. For example, offering a resident a drink of water or juice regularly throughout the day helps them meet their fluid needs. Proper hydration supports overall health and bodily function. Question 68. What is the definition of HIPAA in healthcare? A. Health Information Public Access Act. B. Home Independence and Personal Assistance Act. C. Health Insurance Portability and Accountability Act. D. Healthy Individuals Protection and Aid Program. Answer: C. Health Insurance Portability and Accountability Act. This question tests your knowledge of a crucial legal standard in healthcare. HIPAA stands for the Health Insurance Portability and Accountability Act, which is a federal law that primarily protects the privacy and security of patient health information. It sets rules for how patient data can be used, disclosed, and accessed, ensuring confidentiality. For example, under HIPAA, a CNA cannot discuss a resident's medical condition with their neighbor or post details about a resident on social media. Maintaining patient confidentiality is a fundamental ethical and legal responsibility. Question 69. A resident is on intake and output (INO) monitoring. What is the CNA's responsibility regarding INO? A. To calculate the daily total of fluids ingested and excreted. B. To record all fluids consumed by the resident and all fluids excreted. C. To administer intravenous fluids. D. To instruct the resident to limit their fluid intake. Answer: B. To record all fluids consumed by the resident and all fluids excreted. This question explains the CNA's role in monitoring a resident's fluid balance. Intake and output (INO) monitoring requires careful tracking of all fluids a resident takes in, e.g., beverages, for fluids, food that melts to liquid, and all fluids they excrete, e.g., urine, vomit, liquid stool. The CNA's responsibility is to accurately measure and record these amounts. For example, if a resident drinks 240 milliliters of juice, you would record 240 milliliters under intake, and if they void 300 milliliters of urine, you would record 300 milliliters under output. Accurate INO monitoring helps the nurse assess hydration and kidney function. Question 70. When applying anti-embolism stockings, TED hose, to a resident, what is an important consideration? A. Apply them tightly to provide maximum compression. B. Ensure there are no wrinkles or creases in the stockings. C. Apply them only at bedtime. D. Remove them only once a week for cleaning. Answer: B. Ensure there are no wrinkles or creases in the stockings. This question focuses on the correct application of TED hose, which are designed to improve circulation and prevent blood clots. The most important consideration when applying anti-embolism stockings is to ensure they are smooth and free of wrinkles or creases. Wrinkles can create pressure points, potentially impeding circulation and causing skin breakdown. For example, after putting on the stocking, you would gently smooth out any folds from the foot up the leg. TED hose are usually applied in the morning before the resident gets out of bed and removed at least once a day for skin checks and hygiene.